Is everyone happy with that?
Yep, sounds good.
Cool. We got this. We got this. Live now. Ora koutou te whānau, nau mai haere mai, ki tēnei whakawhitiwhiti kōrero. A tuatahi kōwai tēnei, he uri tēnei, no Rangitāne, Kahungunu, rongo mai wāhine, rā koe pāka ko Sophronia Smith, tōku ingoa. Welcome to Let's Talk COVID-19. My name is Sophronia Smith and I'm your host for tonight. This Facebook Live is brought to you by Wairarapa Tēnei, a collective of Wairarapa Māori organisations supporting Wairarapa whānau during COVID-19 rāhui periods. The views expressed on this Facebook Live have been brought to you by Wairarapa Tēnei. I want to acknowledge our technicians, Amber Craig, who is streaming this to Wairarapa Tēnei Facebook page, and Toby Mills, who is streaming to Wairarapa TV. Whānau, tonight our guest speakers will give a kōrero, and then you'll have an opportunity to ask them questions. The questions can only be sent through the Wairarapa Tēnei Facebook page. And we ask you that you follow a set of tikanga or protocols while in the online chat sending through your questions. So ensure your language is guided by aroha, compassion, by manaki, showing respect, and whakamana or enhances the mana or prestige of others and does not whakaiti or belittle. Before we introduce our guest speakers, I want to hand the rākau to Rikihana Fox, son of Marama and Ben Fox, and the Kaitātari Māori advisor for Masterton District Council, who will open with our karakia.
Tēnā koe Sophronia, utira tēnā tātou katoa, tātou te whānau o te Wairarapa, kua karawhiti mai nei, te pō nei kia whakarongo ki e nei kupu tūpato, etahi kupu rōreka, etahi kupu hei whakamahana i a mātou, hei whakamātauria i a mātou. No reira, ko tēnei e tuku mihi atu ki a tātou manuhiri, ko ta tūna mai nei, te pō nei, kia tēnā koutou, nau mai ki te Wairarapa, nau mai ki ngā kānohi te Wairarapa, kare koutou, ko ka kitea i a rātou, engari, ko hara mai te tini kia whakarongo ki ngā kupu i te pō nei, no reira ki o manuhiri, ki ngā manuhiri, ko mauri a mai ngā mātauranga mō tātou katoa i te pō nei tēnā koutou katoa. O te rā i raro i tērā whakaro, anei te tuku karakia. Mai arara, mai arara, mai arara te rangi rungara nei, mai arara te papa i raro nei, mai arara te kāhui ariki, te kāhui tipua, te kāhui tauira. Tuku ana, tuku ana. Tuku ana te reo kia rere, tuku ana te kupu kia taka, tuku ana te take kia mau ue ha, ue ha. Ue ha nuku, ue ha rangi, ue ha tāne nui a rangi tāne whakapiripi. Nāna i toko te rangi kia tū ha ha. Kia tū ke ana rangi, tū ke ana nuku. Ka tangi te hau, ka mātau, ka ao, ka awatea, he ao mārama, tihei mauriora. Kia ora tātou.
Tēnā koe Rikihana, nau I whakatuwhera te whāriki mo tātou te pōnei, tēnā koe. So now we're going to turn to our four speakers, our special guests that we have. I do want to give special mention to Dr. Jared Green, who is coming in from the Waikato. So Marise, I'm going to ask you to start, and then we'll have each of our guest speakers introduce yourself. Can you tell us who you are, where you're from, your health career background, and your current role?
Kia ora, Sophronia, tēnā koutou, tēnā koutou, tēnā koutou katoa, nā mihi nui kia koutou. Ko kaikohi toku kāinga I nainei, engari ko Ngātuere, ko Nāmana oku whānau ki Wairarapa, ko Rangitāne, ko Kahungunu oku iwi ki reira, ko Pāpāwai, ko Purenui o rangi oku marae, ko taku tā te mahi. Kia ora whānau, ko Marise Stuart tuku ingoa. Kia ora everybody, my name is Marise, I'm a medical doctor, currently based in Kaikohe, but grew up in the beautiful Wairarapa and dearly miss it. Involved with some of Rangitāne's investment space at the moment, but living in Kaikohe and working in housing at the moment, set up the COVID response for Ngāpuhi last year, and very much keeping in the mix with what's going on at the moment, but lovely to speak to you all today.
Triny?
Technology. Ngā mihi nui kia koutou, ko Triny Ruhe taku ingoa, ko Ngāpuhi, rawa Ngāti tō te iwi, GM at Whaiora, been in the health system for the last 20 years and admin management side of things, non-clinical. So at the moment we're open for business at Whaiora, continuing to do medical services, swabbing, vaccinating, acute presentations, whatever we can at the moment. Really nice to be part of this panel tonight. Kia ora.
Jared and then Miriana.
Kia ora tātou, ko tauhara te monga, ko Waikato te awa, ko taupo nui atia te roto, ko Ngāti Pākehā te iwi, ko Jared Green toku ingoa. Jared Green's my name. I'm an infectious disease specialist at Waikato Hospital in Kirikiriroa. I work as a rural hospital specialist part-time and Thames Hospital as well. For the last 4 months, I've been working in Wellington on the COVID vaccination and immunisation program at the Ministry of Health. I finish up there next week. I've worked with Marise on and off for quite a number of years. It's a good pleasure to be with you tonight.
Miriana?
Kia ora, ko Miriana tuku ingoa, ko Ngāti Apa te iwi. I'm a practice nurse with Kelburn Northern Medical currently. I was previously in Auckland working for a Māori health service provider with Marise. And now I do Māori health with my current practice. We vaccinate and we also swab. So yeah.
Kia ora koutou, tēnā koutou. Okay, thank you for sharing, for making those connections with us. And now we're going to start with our kōrero. And I've got a set of questions that I'm going to open up, and I'd like to hear from, for the clinical kaupapa, from Miriana, Marise and Jared. And then we do have kōrero specific to the vaccination centres and in Wairarapa, and I will present this to Triny. The first question is, so the Delta variant, as we know, has hit Aotearoa and the nation is in level 4. What is the Delta variant and why is it so deadly, and will it evolve?
So the Delta variant is a type of COVID-19 that first appeared in India. The thing that makes it unique is it's had a mutation or a change in its structure. That means it's stickier, so it's more infectious. So say the original COVID you'd expect might infect between 2, for every person who had the original COVID, it might infect between 2 and 4 people. With Delta variant, because it's stickier and it's more easy to spread, it might infect 4 to 6 people. So if you think about it, most people will have, if they're out infectious in the community, between 20 and 30 what they call close contacts. and up to 20 to 25% of those people might get infected with the Delta variant if people are out in the community infectious, because it's extra sticky. Some people have thought that it might be less lethal than the original COVID, but it's likely to cause a lot more problems if it gets into the community and established in the community just by sheer volume of infections that it causes. COVID tends to be particularly more lethal as the older you get. So for people, I think the death rate from COVID starts increasing quite sharply after about 50 to 60 years of age, and up to about 40% of people over 90 who get COVID will pass away. That rate's maybe 15 to 20% if you're 80 to 90, a little bit lower if you're 70 to 80, but it really starts swinging up after the age of 50. The age bands I'm talking about don't really apply if people have chronic lung conditions like asthma or emphysema or heart disease or diabetes or things like that.
But I think, Jared. Marise or Miriana, do you have anything to add to that?
I think...
No, I think, yeah, that pretty much covers everything with regards to that. In regards to the last question, coronavirus is always mutating. So the Delta variant will eventually change. We don't know how it will change, just that it will. And as with normal influenza, COVID-19 will need updated vaccinations for us to be able to keep on top with the new variants.
And one of the important things we can do as a community to try and prevent new vaccinations, new variants emerging, is to have as little COVID in the community as possible. So the variants happen when there's lots of COVID, either in one person or a lot of individuals in a particular space or in a country. So I think countries that have suffered quite a lot so far, like Britain or the USA or India or South Africa, have created their own variant or mutation of COVID just by volume of the number of cases that have emerged in those places.
Yeah, so funny, I'll just add a little tidbit to the end of that. And I guess it's just, you know, I think we did well last year. New Zealand did well as a country. And I think, yes, we can pat ourselves on the back, but it doesn't mean that it's going to be any easier this time. And so the course and the protections of kaitiakitanga, the measures we took place that we put in place last year, we need to be just as vigilant. And I think it's quite easy to be complacent at this time. So I guess my add-on kōrero to what's already been said by Miriana and Jared is that we all need to come together on this and do our best to keep ourselves well, keep our whānau well, and keep COVID out of the communities.
Thank you for that kōrero, Kia koutou. As you know, Wairarapa, just today I was down at the local shop and was advertised, they had advertisement up there that there was 23 cases in Wairarapa. So I know that makes us feel a lot anxious, but touching on what you said, Marise, that it is going to be a collective effort to be able to to keep ourselves safe. And that brings me to my next question, which, and a lot of our whānau have questions specifically in regards to the vaccination itself. Is it safe? What's in it? Will the Pfizer protect against the Delta variant and the other variants? And I think, Miriana, you might have talked about that a little bit before and said that the virus will mutate or will evolve, and then there possibly could require other vaccinations, but correct me if I'm wrong. So I'm going to turn it over to the professionals to speak about that.
Kia ora, Sophronia. No, you are correct. So as our variants mutate, you'll see the same thing that we see with the seasonal flu. We get an updated shot according to the hemisphere every year. And so eventually we'll need to keep updating our coronavirus ones as well, so that we are getting the best protection we can for each variant. Pfizer is supposed to help towards protecting us against the Delta variant, but it is not made specifically for the Delta variant. So that's where that will differ. Eventually they will come out with one, but obviously it wasn't one of the first variants, so therefore it is not in any of our first vaccinations.
And I just want to, before I get Marise and Jared to talk, I just wanted to clarify what I said before. And I talked about the local cases potentially. They are close contacts isolating, they're not confirmed cases. So just wanted to clarify that. Yeah. So now I'll hand the time over to Jared and Marise just to talk about vaccination, what's in it, will it protect?
So we're only using the one vaccination type in New Zealand at the moment. That's the Pfizer vaccine. That's a type of vaccine that is being used widely for the first time at the moment, but it's not new technology. One of the reasons that it's being widely used at the moment is a type of technology that's actually quick to assemble. So what's in the Pfizer vaccine? There's something called some mRNA, and I'll talk about that a little bit more in a moment, and some preservatives just to keep it stable enough to get from being thawed to going into your arm. mRNA is kind of like a set of plans, and it's the set of plans that for something called the spike protein, which is how the COVID virus sticks to cells in your lung and your throat. So the plans, when you get vaccinated, kind of go into the muscles in your shoulder. It goes into the muscle cells and it uses the machinery in the muscle cells to actually make some kind of simulations or fake spike proteins. And the mRNA plans last in your body a short number of hours, and then it makes some spike proteins that go into your muscles and kind of turn on your immune system. So the first one's kind of like the first training run. Then you have a second training run 6 weeks later or so. And what it does is it means that if you encounter the coronavirus at any stage in the future after you've been vaccinated, that your body recognizes it without having met it before. So it's able to actually go from training to protecting you straight away. It doesn't need the lag period where you get an infection and then start fighting it off. You can start fighting it as soon as you meet it. So the vaccine itself stays in your body for a very short period of time. It turns your immune system on. You create a reaction so you can start recognizing it, then you prime it again and you strengthen that training so that your body knows what it's doing if you ever come into contact with COVID. Will it protect you against the Delta variant? So there's relatively good big studies overseas that show that close to 90% of people, or 9 out of every 10 people that get 2 Pfizer shots, so both shots, shot 1 and 2, 90% of people will never get COVID once they come in contact with the Delta variant. So there's an additional part of protection for those people that still develop an infection despite being vaccinated, which will be unusual. So it's upwards of about 98 to 100% protective about people getting seriously unwell. So if someone does get COVID, it can cause a pneumonia or lung infection, and an inflammation affects in other parts of your body. That's kind of moderate to severe COVID. What it tends to do if people are vaccinated and get COVID is it takes that pneumonia and turns it into an illness more like the RSV or colds or a more mild flu-like illness. So for the significant majority of people, it'll protect you from getting COVID at all. For an extra proportion of those people who do develop COVID, it will turn severe COVID into very mild COVID.
Thank you. Thank you. Marise, did you have anything to add to that?
No, I think Miriana and Jared covered that really well. But I guess the main thing is for whānau that I can add to add some value is that it's up to whānau really to make sure that they're getting all the information they need to make a good decision. It's actually there's a thing called a patient code of rights, and patients have the right to be informed. And so if people are on the fence and they're umming and ahhing, Healthline is providing this kind of information. And so I'd really encourage whānau to get that information. If they're scared, apprehensive, they've heard rumours that this, that and the other things in the vaccine. Jared's just pointed out what's in the vaccine. And so I'd really encourage whānau to get themselves as well informed as they possibly can, so that they can make good decisions for themselves and their whānau.
Kia ora koutou. Yep, some great advice there in terms of finding reliable sources to go to and to help you understand the vaccination and what is in it and how it affects the body or how it protects us. So kia ora koutou. There was Dr. Rawiri Jensen, and Marise and Jared and Miriana, you will know him, a physician, Māori health advocate, says that the impact of COVID-19 is disproportionately greater in Māori and Pacific communities. What does that mean, and in what ways can our communities be impacted?
Yes, that's correct. Māori and Pacific people are more at risk of developing COVID-19 and having serious complications because of it. As Jared explained earlier, a lot of that is due to our comorbidities, so our health conditions that we already have. But some of that is also due to us as a people. We're closer than some of our European counterparts. We awhi more, we live closer together, and so we are also passing it along far easier than some of our counterparts.
Marise, did you want to add to that?
Yeah, just trying to say, I think Jared is going to go too. I'll just add in some points here, and I guess there's a few ways of answering that question, and I think we could say in terms of the health, yes, and then in terms of the economic arguments that are being put up, definitely yes. And then socially, well, I think, as Miriana's pointed out, socially, or how we connect with each other through the way we live, the way we work, the way we are, does put us at higher risk. Having said that, and this is kōrero from some of our kaumātua who, back in the day, talked about how cleanliness and washing your hands is something my grandmother used to, we'd be in big trouble if we didn't wash our hands every time. I'm probably slacker now before eating kai than I used to be when I was younger. So we have this inherent awhi within our tikanga where we will help each other, and it's just about how we put these precautions into place. So careful hand washing, keeping in your bubble, all those messages that are going out there. It's just about kaitiakitanga. And I think if we put that as our value set foremost, then we are going to protect our whānau. And just coming to that economic argument, and it's the reason why I've gone into the housing space really, is that pre-COVID, things were already, the statistics were already down for us as a people. And, people are going to be laid off, and often, Māori are overrepresented in labour stats. So if people are going to be laid off, it's going to be those people more so. And so there's a huge argument there as well for the economic impacts for Māori.
I think Rawere made particular reference to some journal papers that have been published relatively recently that showed that Māori and Pacifica people were more than twice as likely to be admitted to hospital with COVID. So that means more likely to get severe COVID than non-Māori. I think the burden of some of those conditions I talked about earlier, like emphysema and heart disease and diabetes, is higher in Māori and Pacifica. And in certain parts of the country, unfortunately, I think Māori and Pacifica vaccinations are lagging a little bit behind non-Māori and non-Pacifica rates. There's a lot of talk about herd immunity when it comes to vaccination frequently, but the way that society operates is we're multiple little herds. So if some group of the population, say, gets to 98% vaccinated and they're unlikely to have outbreaks, and another group in the population sits at 50% vaccination, then where the outbreaks occur will shift towards where there are lower rates of vaccination. So if Māori and Pacifica rates of vaccination lag significantly beyond European, I think that will shift the burden of outbreaks in the future into Māori and Pacifica even more, which would be tragic.
Yeah, thank you. Yeah, there's a lot in that kōrero, and it would be definitely tragic. So yeah, ora koutou. Is there any last comments on that one? Or shall we go to our next one? We'll go to our next one. We've got a huge number of questions that are coming in from our whānau, which is great. And whānau, I will start asking our questions. We've just got one more question to ask our ropu, and then we will start actually going through all of your questions, and there's some amazing questions. So the question, and I will ask Triny this question. Triny, where can whānau get vaccinated in the Wairarapa? And what role do you think Māori providers have in terms of a rollout of the vaccination, COVID-19 vaccination in our community?
Kia ora, Sophronia. Well, I suppose the role that Māori providers have to play is to support or get the information out to whānau that they're after, so that they're getting accurate information of what's in the vaccines, how to access the care or the vaccines that in the different areas in Wairarapa, and just being there to support them with, to access the services that they need. At the moment, there are 3 static clinics in Wairarapa. There's Tacoma Iwa. We're open Fridays and Saturdays weekly, 9 o'clock to 5 o'clock. We're looking at opening up a Thursday clinic in the next couple of weeks. There's a DHB clinic in the government buildings in Chapel Street in Masterton, and there's also a clinic, a vaccine clinic in Featherston in the community centre. So to access any of those clinics, you can ring 0800 28 29 26. It's a national booking system, and you can select the time and the site that you'd like to go to. That booking centre's open 8 o'clock to 8 o'clock, 7 days a week. You can also go onto the website bookmyvaccine.co.nz, I think it is. We can put the link up later, and do an online booking as well. So that's 2 ways to access or make appointments. Just one other thing I probably want to add to what the panel have talked about is scanning. Use those QR codes to scan the sites that you're visiting, because that can just help tracing should COVID get into our community, and it's easier to get in touch with whānau should they be a close contact, etc. So use those QR codes because they will help keep you safe.
Kia ora, Triny, thank you for that. So we will put the links up on the Ko Wairarapa TNA page in terms of where you can get vaccinated at the 3 static clinics that Triny referred to. We have, like I said, we have a number of questions that have come through, and we're going to start. I'm going to start asking the questions, and I'm going to ask the 3 of you, and Triny, if you would like to answer as well, if it's in regards to Te Kaimaiwa, one of the centres, feel free to answer. The first question is, does having the vaccine make it less likely to transmit the virus?
That's really difficult to say. We think so. So there's a link between how much virus you have in your nose and throat and lungs and how likely you are to transmit it. And we think that if you are vaccinated and you do get a mild case of COVID, that you're likely to have less virus in your system and be less likely to give it to other people. It's a little bit uncertain with the Delta variant because it's new. But even if it doesn't prevent you from transmitting it, if you're vaccinated, it's highly effective at preventing you from getting bad COVID.
Kia ora. Did anyone else want to add on to that? Thank you, Jared. Okay, our next question, and this is specifically for Marise, concerning COVID-19, in your medical opinion, do you think this New Zealand government have performed due diligence in its efforts to ensure the safety of its citizens?
Sorry, Sophronia, was that the vaccine?
Yeah, to ensure have performed in its yes, and concerning COVID-19, yeah, so that it doesn't specifically ask that or have that question, the vaccination in the question. So I'm assuming, I'm going to make the assumption that they are referring to that. So concerning COVID-19, in your medical opinion, do you think this New Zealand government have performed due diligence in its efforts to ensure the safety of its citizens?
Yeah, and I guess what I'll do is I'll provide an answer, but I'll open it up to everybody else because everyone else is playing a role. And I think, you know, if we're saying due diligence, there's a whole heap of things that affect that. So whether it's border controls, both internationally, regionally, and then locally. So that's a prevention side. You've got your testing piece there. You've got your vaccination piece there. And then you've got all your health education messages. You've got all the other wraparound pieces where we're required to, you know, go and buy food and all the measures that to keep ourselves alive and all the measures that affect those. So I guess due diligence in that process, I think the New Zealand government is doing a reasonable job, given that COVID-19 is it's not new anymore, but it's an ever-evolving infection that Mediana and Jared have already explained. They're constantly learning. I won't make any excuses for the government and where there's been, you know, movements of infected peoples from different places to the other, but I think it's always easy to criticise when the shoe's on the other foot. And I think the best thing that we can do is actually get on board, and really efforts really are whānau to awhi each other, take the precautionary measures and do our bit to protect each other. And I think that's all about he mana tangata, you know. That's a tikanga, a kōrero. And so I would hate for us to be singling out certain individuals or certain groups when this is something that's a threat to the whole entire world at the moment. I'll pass the rākau to anyone else who wants to add any points onto that.
I think one of the most important things we can do at the moment, irrespective of what we think of the government's kind of success or due diligence, is have each other's back. I think our ability to coalesce as a community and be behind each other and support each other through this is kind of the key to our success.
Kia ora, Jared. Miriana, do you want to add anything to that kōrero?
I think they both covered, having COVID-19 in the community. I do want to point out, though, with the vaccine, so there was a lot of upset, I guess, with how the vaccinations were rolled out, with some places being given vaccinations before others. Now, the government did the initial plan, and then the next tear down is generally the DHB, the Ministry of Health and the DHB, and then the DHB contract that to the PHOs. And so with every level, you get another group of people in there, and everybody has to sort of want to do the same thing before things like the vaccinations can roll out, and we can make really good plans about how we can get that to whānau. And so I think a lot of that was kind of behind the scenes, so you wouldn't see that side of it. It can just look like we're taking a really long time to get these vaccines to you.
Miriana, great points. Yes. Yep. Okay, I'm going to go to our next question. There is information that suggests there is nanotechnology in the vaccine. Is this true?
Nanotechnology, no. What's in the vaccine is mRNA. Like I said, that's kind of like a short genetic plan for the body to assemble something that looks like a spike protein, or the spike protein from COVID, so that your muscles manufacture some of it, so that your immune system gets trained how to recognize it, and trained a second time how to recognize it, so that if you ever encounter COVID in the community, your body knows how to react to it straight away. There's no nanotechnology in the vaccine.
Good, Jared. Okay, so I'm going to go through to our next question. This is from Maxine Hemi. What about those with allergies? Is the vaccine safe for them?
They're very safe vaccines. I think a lot's made of how quick they came to market, and I think that's because the world felt a significant amount of time pressure to produce something to address the pandemic. But these are some of the most well-studied vaccines, and millions and millions and millions of people throughout the world took these safely before they first came to Aotearoa. People with allergies can safely receive the Pfizer vaccine. Sometimes at vaccination sites, it might mean that instead of you being observed for about 15 minutes after your jab, the site might want to keep an eye on you in the observation area for 30 minutes. The only reason you would not be able to get a Pfizer vaccine due to allergies is if you were allergic to some of the things in the vaccine that are used to stabilize it, like propylene glycol. But people with general allergies, including allergies to other medication, almost all the time can safely receive the Pfizer vaccine.
Kia ora, Jared. Okay, so I'll go to the next question. Does the nucleoside modified messenger RNA encoding the viral spike glycoprotein or S of SARS-CoV-2 alter DNA or genes? I think for many Māori, there's a major concern protecting whakapapa in that way. I understand in comparison with the negative effects for some, it's of minimal concern, but for our whānau, we are about protecting whakapapa.
So the questions about the integrity of the self and the integrity of whakapapa when receiving the vaccine. Yep.
Yes.
So that the mRNA itself can't get into where your genes are stored in the nucleus of your cells. It kind of exists just as a floating plan to get into something called the ribosomes in your cell, which are basically just factories that assemble proteins together. So it can't interact with your DNA, it can't become part of your DNA, and it cannot change who you are. The only thing that it can change about your body is its ability to recognize COVID. So your whakapapa is safe.
Okay, thank you, Hilda. Marise?
Yeah, so Fronie, I just wanted to add on there, it's great that all these questions are coming through. And I guess if we, look at it from a ki te whaiao, ki te ao marama, how we enlightening ourselves by asking these questions. So no question is off the cards. So please fire them through, because I think the more understanding we can get about these things, then the better we can make decisions for our whānau. So just acknowledging that to the questions coming in.
Kia ora. And that question was from Sonia Rimene. Next question is from Charlene. What are your views on Denmark abolishing all corona measures effective October 1st?
So could you repeat that again, Sophronia, please?
Yeah, a question. What are your views on Denmark abolishing all corona measures effective October 1st?
I must admit I didn't know that Denmark was going to abolish them. In New Zealand, I don't think we're in the position to do the same thing at the moment. I think that we want to make sure that all groups in our community are adequately protected and that we know how to be COVID safe for the future. Even if this becomes something that becomes a more mild illness and floats around that we see occasionally in general practice or in hospitals. So I think all of the things that we do to be COVID safe are still really, really important in Aotearoa. I think the most important part of being COVID safe is getting vaccinated. That'll help protect our whānau, our communities, and ourselves. But other things we've talked about, like hand hygiene, making sure that we're not around other people if we're unwell, so as to not put them at risk, to make sure that we're on top of our hand hygiene, to make sure that we're using our QR codes, or if we don't scan in, to make sure that we're logging in, so that if something unfortunate like a COVID exposure does happen, that our contact tracers are able to try and stamp out any outbreaks really, really quickly. And there's other important things, like if we do have to cough in public, making sure we cough into our elbows, things like that. And I think making sure that we're good community members and we're in it for each other is really, really important. So in terms of Denmark abolishing all of their COVID measures, very, very certain. I'd hope that they've got really high vaccination rates, and I'd hope they're really good at their COVID safe stuff. But I think there's some important equity gaps in vaccination and healthcare in New Zealand at the moment that means that we shouldn't do that kind of thing at the same time.
Yeah, good point.
I feel like we should bring us back to the point with regards to that, because Denmark is definitely not New Zealand. Our people are much higher risk here for developing COVID complications that can lead to death. And while it would be amazing to be mask free and be able to go back to the way things were before the pandemic hit, I think it's whānau safety that should be in the forefront here.
Kia ora Miriana, thank you for that. Marise, did you want to add on to that kōrero?
I guess I know that there's a lot of traffic online about all the amazing things people are getting up to during COVID lockdowns, whether it's from housing repairs to baking to upholstery and sewing and lots of different crafts and putting out a marae. And I'm just talking to a neighbour today who said that now's the time to be putting down some kumara. So I think, and I guess slightly on a tangent to that question, is thinking about how we can keep ourselves well within our bubble. And if we've got a backyard, is it a time to put down kai because we don't know how long this lockdown's going to go? Is it a time to rekindle some whānau relationships on the phone or through Zoom? All of these different things. And so I think it's a great opportunity to do some reflection and some whānau strengthening.
Yeah, rawe. Okay, thank you for that. We've got a question from Johnny Rutene. So before we did, the question was, is the nanotech in the vaccination? And Johnny is asking, why is there no nanotech in the jab?
I'm not sure how to answer that one. The mRNA itself is producing pretty good immunity, so I don't think we need the nanotech in the vaccine we've got at the moment. I'm not sure what role nanotech has in other vaccines in the future. I'd have to ask a vaccinologist that.
Kia ora, Jared. Okay, so this is from Charlene. What are your views concerning the New Zealand petition calling that COVID-19 vaccines are voluntary and vaccines should not be forcibly administered as per the Human Rights Commission Act 2021?
So that's about a call for vaccines to be voluntary. Yeah?
Yeah, should not be forcibly voluntary, and vaccines should not be forcibly administered. So what are your views about that?
Yeah, so vaccination for the general population is voluntary. I think there are certain jobs and things that in the past and in future might require you to be vaccinated against a variety of different things. So it's not specific to COVID. My views. Why did I choose to get vaccinated? I might talk about that for a little bit. Just I guess it's relevant. So I'm a frontline healthcare worker. My dad's in his 80s. My mum's in her 70s. I moved back from Australia to spend a lot of time close to them. So my personal risk from COVID is not that high because I'm relatively young. Marise? Yep. Real young. But I think the risk I might pose to other people is that I'm more likely to come in contact with COVID from people who are quite unwell with it because I'm hospital-based, and I'm at a higher risk of passing COVID on to other people if I pick it up, particularly my whānau who are of a more advanced age. So for that reason, I chose to get vaccinated. For me, it was voluntary. I think for most people, it would be or should remain voluntary unless you're at specific high-risk jobs. But I would encourage other people to kind of think about what what their individual values are with respect to vaccination and ponder on that. So I think sometimes, particularly for rangatahi, other youngish people, the benefits of vaccination aren't necessarily for you personally, they're for your household bubble, they're for your whānau, they're for your friends, they're for your kaumātua.
I tautoko te kōrero, Jared, and I guess the opposite question needs to be asked, and I'll ask this because I've remember when there was a campaign anti, I think it was a meningococcal vaccine in South Auckland on a billboard, and where a lot of our whānau have that infection at a higher rate anyway. And I would I challenge people who are, you know, pondering these things to ask the question of why people are anti-vaccination, and who is more at risk. When we know it's our people that are at risk, I would question why then are people encouraging anti-vaccination. And it is a strong whakaaro, but I personally love our kaumātua, and I also love our mokopuna who are coming through, and I want them all to be alive forever if they could be. And if it means taking one for the team, you know, if we are able to have it done, and I've had mine done because of mahi as well, but if it means having a jab to awhi our whānau, then I personally think that's worth it. But that's my whakaaro, and just, yeah, not pressuring anybody, but that's just a whakaaro to ponder on.
Yeah, kia ora, kia ora. Okay, this question comes from Memory to Whaiti. If you are not vaccinated, does that mean you are a risk to others?
There's two ways of thinking about this. I think if someone decides that vaccination at this point in time is not for them, the door remains open to them to change their mind. Okay, so COVID vaccination's not going to stop on November the 30th. I think there's going to be catch-up vaccinations that need to occur, and some people might change their mind from not wanting a vaccine to getting a vaccine. And there are certain types of people who in the future might need a booster, like people who've had kidney transplants or on dialysis and things like that. Are you a risk to other people? I think we'll hark back to the community and the whānau thing we're talking about. The more of us that are vaccinated, the stronger our group protection is, and that protection might not necessarily be for you, but the more people that decide not to accept vaccination, the more likely it is that the whole community might lose some of its protection. And when you think of what they call herd immunity, New Zealand's not going to be one herd when it comes down to the numbers. We might have a Wairarapa herd, we might have a Taupo herd, we might have a Pacifica herd, we might have a refugee and migrant herd. So I think unless each of the groups we move in has a strong level of whānau or community protection, we're at risk as a group.
Sorry, Jared. So this question comes from Maxine Hemi. What should you do to protect children with low immunity? And that question in terms of people with low immunity is coming through quite strong.
Yeah. Was there a specific age mentioned?
No, there wasn't.
Okay, so the age groups that can get vaccinated are changing with time because it's changing with research that's emerging overseas. So I think the reason that 16 and above and 18 above were the first bands of vaccination is because studying in adults is something that's always done before you study it in rangatahi. So 12 to 15-year-olds are now eligible for vaccination, and they can start booking vaccinations now. For younger children with low immunity, I think it's really important that the household bubble and the whānau considers getting vaccinated very strongly. I think if children are under 10, if everyone who's eligible
It
for
was under 10. Sorry, Maxine just came back, under 10.
That's all right. I saw that come up.
Yeah.
Someone's under 10 and they've got low immunity, you can offer them a degree of protection by protecting everyone else in the household. It's called cocooning. So what you can do is you can build an anti-COVID vaccine shield around that young person. And then the other COVID safe things are important for them, like masking while you're outside, hand hygiene, coughing in your elbows, not having visitors who are sick come around if they're sick at the time, waiting for them to get better, and things like that.
Good, Jared. This is from Andy McKenzie. What's the best time between first and second vaccination?
What's the best time?
Time gap for, yeah.
Yeah. So they originally studied at 3 weeks apart, which is really early for vaccines, primarily because overseas where there was lots of COVID at the time, they wanted to get cracking and protect as many people as possible. Countries like Canada and Britain have actually used 6 to 12 week spacings. The CVIP has started recommending that 6 weeks is the normal gap between vaccines unless people are at risk of immediate exposure, like they're an unvaccinated border worker. So 3 weeks like I had and Marise probably had works just fine. 6 weeks is potentially even better, but 3 weeks is pretty good.
Kia ora, thank you. So we have a few hapu mama or asking the question, is it safe to have COVID vaccination when pregnant?
Yeah, it's very safe. Many hundreds of thousands of pregnant women have had COVID or Pfizer COVID vaccination overseas without any issues. So I think it's, if you are pregnant at the time or pregnant now and you're eligible for your vaccine, I would recommend it. The only thing you need to do at the moment is just space it around your other pregnancy vaccines, like your whooping cough and your flu vaccines.
What about those that are on blood thinners, example warfarin?
Blood thinners like warfarin, that's safe. You can give the vaccination the same way, and it doesn't give you a significant risk of having big bruising or hematomas or things like that. It's a pretty small needle. Sometimes for people who have different clotting disorders like haemophilia, it's important to try and work out with your hematologist when you can get your blood factors so that you can get them on board before you have your vaccination. But warfarin, dabigatran, rivaroxaban, clopidogrel, aspirin, it's safe to get vaccinated.
This is from Sonia Rimene. I have had cancer, so deemed immune vulnerable. Does that mean my immune system is more at risk?
So the question is, you've had cancer and you're wondering about your immune system. Sorry, guys.
Yeah, and been more at risk, yeah.
Yeah, sorry, guys. I'm talking a lot at the moment. Yeah, I think it depends. I think I'd definitely recommend that you get COVID vaccination. Whether your immune system's low depends on if you've had chemo or other anti-cancer drugs recently, but I think if you have had cancer in the past, it's safe to get a Pfizer vaccine, and I'd recommend that you get a Pfizer vaccine. It'll give you good protection, and it's safe for you to have.
Johnny Roots, why do all vaccines have to go through a process to be approved to be safe over a 7-year process? Why have these vaccines not been through animal trials? Have there been any human trials to certify proven for human use? Nuremberg Code 1947. Sorry if I pronounced that wrong.
That's all right. So the vaccine approval process is usually a lot slower than what's been used this time. That's perfectly true. These have been studied really extensively in in human trials overseas, and they've been shown to be really safe. And in terms of vaccine efficacy and vaccine protection, they work spectacularly well. So none of the usual corners have been cut. It's just been done a lot more quickly. And the reason it was done more quickly is because there's a pandemic and there's millions and millions and millions of cases of COVID around the world, including millions and millions of cases that have gone undiagnosed in Latin America, Asia, Africa. So none of the corners have been cut. It's just been able to happen a lot more quickly with the approvals and the studies because of the sheer volume of numbers of COVID. And because of the numbers of COVID, it's been possible to pick up how effective these vaccines are a lot more quickly. Things like measles and stuff like that tend to be less common and occur just in spot outbreaks in unvaccinated populations. With COVID, it's something that all of us are susceptible to, so it's really easy to pick up the safety data and the effect data really quickly. In terms of the side effects and things like that, or things you're expecting down the line, I mean, the severe side effects, if people do have adverse effects following immunisation or EFIs, they tend to appear within minutes to a few weeks. They're not things that pop up years down the line.
Kia ora. Okay, so I'll just keep going unless Miriana or Marise, unless I see you in your microphone, I'll just keep asking the question. Okay. Oh, can you explain why the vials are stored below temperature? What will happen to the body if the temperature changes or the temperature in the vials change?
Okay, so that's about the low temperatures that we store them
at? Yeah.
That's just because like the mRNA itself's quite fragile, so you've just got to be careful shipping it. But when they first kind of made these vaccines, they thought they had to be at like minus 80 degrees below zero for ages up until you thaw them, and then you can inject them. Now these vaccines can be stored at standard vaccine fridge temperature of 2 to 8 degrees for 5 weeks at a time. So now they've gone from being something that needs really, really delicate storage to something that for a month at a time we can treat like any other vaccine in the fridge. So the vaccines usually, Miriana can tell me a bit more about process because I talk about it in an abstract sense, but the vaccines often come up to room temperature after they've been drawn up and diluted while they're waiting to be injected. So it would be unusual for a really low temperature vaccine to go into someone's arm.
You want to add to that, Miriana? Yep.
Yeah, so when we receive the vaccinations, we will always write a date and a time of when we received it. And on the box that we receive is the date and the time that they came out of frozen storage. And from there, we have a certain amount of time, as Jared explained, to use that vaccination. We also have very strict rules about reconstituting the vaccine. So we get little vials with a very tiny amount of fluid in them. It takes 2 of us to check them. The ministry is very, very meticulous about how we do this process. So 2 of us must check it. We check to make sure that both of us, that we're using the correct diluent to draw it up. And then that diluent is going into the vial of COVID-19. And from there, we have 2 hours to draw up all of the vaccines from that vial. So on average, we get about 6 to 7 vaccines per vial, and they must all be drawn up within that 2-hour period. anything, so if we don't manage to get in all of those doses before the 2-hour mark has expired, those all get thrown away. So yeah, as I said, very, very strict rules, from freezer to your arm. There is double checking all the way, and yeah, lots and lots of steps to go through there.
Miriana.
So funny, I was just going to add, there's some great questions coming through, and it sounds like potentially even some aspiring assistance in the vaccination space, and people wanting to get all the information they can. I just wanted to reiterate that there's a COVID health line for people wanting advice. If any of this goes over people's heads and they want to have this information reiterated, then I think call this COVID health line, which is 0800 358 5453. That's 0800 358 5453. And particularly if you're one of those people who has a light bulb moment and comes up with another question late at night and you wish you'd asked it, so definitely call that number, and maybe we can post that number on the Wairarapa Tēnei page as well.
Yeah, we'll do that, Marise. Yeah, great idea. www.immune.org.nz is good as well. Is that a good site as well, Marise? Yep. We have a few more questions come through. Elena Hing. Kia ora, could you just clarify, vaccination doesn't stop you from contracting and transmitting the virus. Essentially, it just lessens the severity of symptoms. And if this is correct, how then does it protect others? Thanks.
Okay, so the Pfizer vaccine does both things against the Delta variant. The bit we don't understand yet is how much it prevents transmission if someone develops an infection after they've been vaccinated with the Pfizer vaccine. With the other variants of COVID, we know that it meant that the loads of virus people who got infected were carrying were lower and they were less likely to pass it on. We just don't know that information with Delta yet. But thinking of overseas research, 9 out of 10 people who are fully vaccinated will not get Delta COVID. And close to like 98% to 100% of people who are double vaccinated won't get severe COVID. So there might be about 8 out of every 100 people who are double vaccinated that might get COVID, but you'd expect them to get mild COVID. So COVID that doesn't get you in hospital, that doesn't get you into intensive care. So remember, this is a virus that all of us are susceptible to because there isn't a seasonal COVID. So it's not like colds and flus and stuff like that where we might have some partial protective immunity. If we haven't been vaccinated or had COVID before, we've got no protective immunity at the moment. So the data as it sits at the moment is 9 out of 10 people with double vaccinations won't get Delta COVID at all. And another 8 out of 100 to 10 out of 100 will not get severe COVID if they do get it. So your chances of getting COVID plummet, and your chances of ending up in hospital with COVID get even lower.
Yep, Jared. This is a question over this one. This is from Raven. How long does this vaccination offer protection, and will there be a need for a booster shot?
Miriana talked about the possibility of this becoming something we need a seasonal vaccine for. This is kind of a field that's evolving at the moment because COVID's only existed for basically one season at the moment. So how long does it offer protection? We're not sure how long exactly COVID offers protection. We know that after your second dose of Pfizer vaccine, maybe 7 to 14 days after your second dose, you're at a high level of protection. And what has been studied overseas is that this protection lasts at least 6 months. And the reason they can say at least 6 months is because when they published these studies, that's all the time they'd had after Pfizer vaccines had been administered. So we know the real world effects of vaccinations protection only for the last 9 to 10 months so far, because vaccination against COVID started wide scale towards the end of last year. Do we need boosters? We may do. I'm not sure at the moment. They're doing studies on boosters at the moment. There's one group of people that do seem to benefit from a third dose, and the vaccine experts in New Zealand will be having a think about that in due course. And that's people who have lowered immune system, like people who've had a kidney transplant for kidney disease and things like that. So we may need boosters. It's something to think about, but we'll know the answer to that question in about 6 months, I think.
Kia ora, Jared. And it was just, I know that Jared has shared a lot of kōrero, and we've put you on the spot a lot tonight, Jared.
Right.
I just, there is a kōrero here from Tiro Maira, Tito. What are your thoughts regarding our babies and the vaccination rollout? Have they developed a vaccine for infants?
What normally happens with vaccination for most of us is that they're specifically kind of developed for a specific age group. So you know when you've taken your baby in to get vaccinated, there are different things due at different times. So Hep B and things like that are due when they're very young, because that's when you want maximum protection. This thing's kind of been done a little bit in reverse, in that they've needed to roll something out really quickly, and they've used technology they could adapt really quickly and focused on adults to start with. What's happening overseas is that they're studying this in younger and younger age groups all the time. So I think that the age groups of people who might be eligible or desirable to vaccinate may evolve further. I think it's gone initially in New Zealand from 16 plus to 12 years and older now. And the data to figure out what level of protection and things like that it offers to babies will be forthcoming, I think. But there's dozens of different vaccines in development, in use and being studied around the world at the moment. So just keep a watch out in the coming months. We'll learn a lot more about this. This is an evolving pandemic. And if there are things that are suitable for younger kids, that are beneficial for younger kids, that help protect our communities, I've got no doubt that the experts in New Zealand will find a vaccine that's appropriate to use here in Aotearoa.
Yep. There's an interesting question come through about the possibility of having COVID-19 passports, or a book saying that I've been vaccinated. Is that something that what's your thoughts about that?
Should our global health scholar dig into that first?
I didn't want to upset anybody, unless is there stuff maybe you go first, Jared, and I'll jump on the back of it.
Yeah, I'm just cognizant of the fact that I'm talking a lot, and I'm sure I didn't talk this much when you worked with me, eh? Passports. I don't know if there's any plans to have COVID passports in New Zealand at the moment. I've been pretty focused on vaccination the last few months. I think in other parts of the world, there might be some requirement for people to be vaccinated to go to certain places, to do certain jobs and things like that. But I just don't know what's going to happen here. I'm not sure what I think about vaccine passports at the moment. I think my thoughts on vaccine are more, it's kind of a more sense of community thing that we should do for each other, and do for ourselves as a secondary priority. I think as much as I want to be able to go and visit the in-laws in Sydney, I'm quite happy staying put for the time being, just to make sure that it's safe and that our community is protected. But vaccine passports?
Yeah, kia ora, Sophronia, for that question. And I guess there's in medicine, whenever we do something, there's got to be a reason why. What is the reason why? Is it because we need to prove to somebody, and if it's an authority, how do we prove that to them? And I guess it would be a way of showing that. I think this was talked about last year in our Uruta a Māori clinicians group, that there was some talk about this within the ministry at the time. However, it doesn't sound like it's gone there. Maybe it's because I'm a geek. I wanted to put it into my COVID app, and then I realized you don't put it into your COVID app and there's no place to do it. So I think it just needs to be thought out. And what is it, you know, these things, if it's a tech thing, there's a small cost to that, but there needs to be a good reason to do it, and maybe some useful thinking about how that might affect us down the track. Say, for example, if we've got variants, is there benefit? Say there's a new one next year, but we can say we've been vaccinated this year, and what were we vaccinated against? I could pass the rako back to Jared on that one, but I guess my key takeaway is what is the reason and who needs to know.
So sorts of vaccine passports aren't new. I mean, this is a sort of vaccine passport that I had. I just had to get it out of the top drawer over there. So that's for my yellow fever. Some countries like Colombia and Panama want to know that you're vaccinated against yellow fever, and sometimes they ask to see it at customs just to make sure that you're safe. Because that's areas where, say, you might have limited health care, you get an illness like yellow fever, you're at really high risk of dying. So they don't want people to go in and catch yellow fever. And there's certain countries like Kiribati and places like that who might want to see this type of thing, because they don't want you to take yellow fever in your bloodstream and then have mosquitoes jump on you and start flying around the atoll to an at-risk population. So it's not new. I don't find this particularly menacing. When I used to travel overseas before the pandemic, I always had this with me just in case someone wanted to see it.
Kia ora, Jared. Okay, I think our whānau have had lots of questions, and I think that there's lots and lots more. But we're going to wrap things up. I want to give us one more chance to, or just closing comments, an opportunity to share one more last piece of kōrero that you want to with our whānau. And I'll start with Miriana. So we'll go Miriana, Marise, and Jared, and then I'll finish with some of the kōrero that I've gained from listening tonight.
Sorry, what do you want me to do?
Any concluding comments that you have? Any last comments that you want to share with our whānau? Yeah.
Okay. Honestly, just have a think about everything that we've talked about today and make a decision that is right for you. Yes, obviously we want to encourage people to vaccinate. If it's not for you, though, it's not for you. It isn't compulsory, and although it does make us all safer, you know, we need you to think about you as well, and keeping you safe and keeping you happy. So yeah, that would be my last takeaway.
Okay. Marise and then Jared.
Tikanga.
Kia ora tikanga, yep. Ka pai.
I'll jump
Jared?
in. Oh.
Yes, Triny?
Yeah, I just tautoko Miriana's comments that whatever your decision is, it's yours. So if you choose to vaccinate, book online or give us a ring. And if you don't, then remember hand wash, face masks, QR coding, just keep yourself safe. Probably just wanted to share too, just local stats. Māori 55 and over, 49% have had 2 doses, 18.5 have had 1 dose. So they're good results. And from 12 to 100 for Māori, the stats are 18% 2 doses and 10% for 1 dose. So the age group has just opened up, so we'd be seeing an increase in those 12 to 55 stats as we move through the next few weeks. But yeah, thank you for sharing the kōrero tonight. And Jared, yeah, lots of insight to what you've shared with us. I've learned a whole lot tonight, so yeah, mihi to you. Kia ora.
Jared, did you have any closing comments?
Yeah, oh, thanks so much for having me along. It's a real crazy time out there at the moment, and I think that the most important thing right now is that we take care of each other. I know these are hard times. This might not be the last hard time that we have for the next wee while. I hope I've answered the questions. We've answered well enough. I think vaccination is something we should have a good think about, you know. I'd encourage everyone to get vaccinated. I think there's a lot of talk about what's a target we should shoot for as a society, and I think everyone is a good target. But it might not be for you for whatever reason. If you decide right now and you're eligible for a vaccine that it's not for you, just remember that that door remains open. And I think vaccination is probably the most important thing we can do to be COVID safe. Particularly if you're a younger person, I think the real benefit of and gift of vaccination is that it protects the people around you. And the more people who kind of like are able to be vaccinated and willing to take on that burden of responsibility and kaitiakitanga for the community, the more strong our barriers are going to be. So vaccine's real important, but as Triny said, other important things are the hand hygiene, the good cough etiquette, making sure we're masked, making sure that we're staying away from other people, particularly vulnerable people when we're sick, and making sure that we're doing our part to be good community members.
Yeah, kia ora koutou. These were, for me, some of the things that I've written down. So I've been writing lots down as you've been talking, and some of the key things that come through are the messages have each other's back. About being good community members, whatever that means, whether you choose to vaccinate or not. But it's about having each other's backs and taking care of each other. There was another thing that Marise mentioned about using the time during lockdown to rekindle farmer relationships, and that's been something that we've been working on. So there are some opportunities here to strengthen our relationships with our whānau during times such as this. But I would like to thank each of you for being here tonight. I think that we could have kept going asking questions, and our whānau had lots and lots of questions. I just want to conclude by saying that for Wairarapa College, would like to stress to our whānau during this rāhui period to keep safe. Horoi o ringaringa, wash your hands, get vaccinated, and if you must go out for groceries or exercise, wear a mask. Keep in contact with our whānau or friends by using your phone or computer. Protect our whakapapa. And that's our big message, is protect our whakapapa. And so we're going to close now. I don't know if Hana, kia koe.
Kia ora, Sophronia. Aroha mai. I just
Marise,
wanted to add some remarks before we go, and acknowledge everybody here getting on the call with only a few days' notice. So really appreciate it. Really appreciate your input, your expertise. Triny, I know you're working all hours of the day, so thank you for for making the time to input to this really important kōrero, and we really wish you well down in the Wairarapa. We're only a phone call away, we're a text away. Miriana, thank you for taking the time to join us from Wellington, and remember there's a job out there for you wherever you want it. And Jared, just really wanted to acknowledge your expertise, and we're so privileged to have, you know, an infectious disease expert on this panel. Wairarapa is just really, really privileged to have your kōrero, he tuhunga, he rangatira koe, ngā mihi nui. And thank you, Ricky, Hannah, and Sophronia, and Amber for hosting us tonight. But just thank you, everybody, and ngā mihi mahana. Kia haumaru, be safe, and kia kaitiaki, you know, look after each other. Ngā mihi nui.
Oti rā, I raro I era whakaro tino hohonu, me ngā kua mihi katoa ngā mihi no reira tēnā koutou. Tēnā koutou, mō te haere mai kia tākoha, te mātauranga kia tātou o Wairarapa, tino pai te rongo ngā kōrero katoa. I just want to mihi from myself personally, and from those that have been watching, I'm sure, and a lot of the answers or the questions that have been answered today. Tino mihi nui kia koutou, for the mahi that you guys are doing as well. It's just a very wonderful examples to us, and especially with this mātauranga that we struggle to understand. And so for people to put a lot of their lives and livelihoods into this mahi so that people like us can understand well. Thank you very much for sharing that with us. Engari kua riro kia hau, kia whakakapi e tā tātou hui te pōnei, no reira I raro e ra whakaro me kara kia tau ai ngā manaakitanga o te wāhi ngaro ki runga ki tēnā o tātou. Kia mahia te hua mā kihi, kia toi te kupu, toi te mana, toi te aroha, toi te reo Māori me ona tikanga, kia tuturu, ka whakamaua, kia tīna, haumie, huie, tai.
Ai ki e.
Kia haumaru.
Whānau.